discussing about a very commonly performed plastic surgery procedure, yet somehow a lot of misconceptions associated with the procedure, that is liposuction. And we have with us Dr. Shivam sir. Hello sir. Sir, so what is this liposuction surgery?
Yeah, liposuction by definition means removal of the fat. So it's a simple thing.
Simple.
So fat is removed in cases where there is obesity. I mean somebody who is obese, either generalized obesity or localized obesity. So where there is a disfigurement because of the fat. Or sometimes even bigger lipomas, they are removed with liposuction. And even enlarged breasts sometimes are removed by liposuction, or accessory breasts, even they are treated with liposuction.
Sir, the fat which is removed through this procedure, do they recur?
See, the number of fat cells in an adult is fixed. They do not uh, multiply in an adult. They multiply only in an infant. So once you are an adult, the number of fat cells is fixed. So whatever the number of cells that are removed, they are permanently removed from the body. They do not recur. What can happen if the person does not maintain the diet, does not maintain exercises? The remaining cells can enlarge. We call it as hypertrophy. There won't be hyperplasia. It means multiplying of the cells.
So now that you mentioned diet and exercises post-operatively, what are the adjuvant therapies needed that in the form of diet and exercises post of the
See,
procedure?
uh, the many of the cases of obesity, either generalized or localized obesity, or sometimes associated with overweight. So the patients come for weight reduction sometimes, or sometimes to improve shape of the body. We call it as a body contouring surgeries. So these are ideal for localized fat collections which remain resistant after trying exercises and diet. So if they do not go with these two mechanisms or even the drugs, so they are ideally treated with liposuction. Sometimes even generalized obesities can be treated with multiple sittings of liposuction. Since we are going to remove the fat itself, there is going to be an indirect effect of weight loss. So it is not the primary effect. We don't do it primarily for a weight reduction itself. It is, we can call it as a side effect where there is a weight loss. So it is required side effect.
Now that you mentioned so many things, there are so many questions I'm going to ask regarding that. Sir, what is the role of this liposuction in body contouring and weight loss? Like you mentioned, it's weight loss is not the aim of the surgery. So what is its role?
So many a times the person who is not confident of the shape, where there is excess fat collection, say for example under the chin, we call it as double chin, or in the nape of neck, it looks like a bulldog. Sometimes even after exercise and diet, there remains a huge amount of fat in the tummy which does not subside on its own. So they are removed to improve the shape of the body, so that once the shape of the body is improved, the patient's self-confidence and self-body esteem improves. So they are motivated to do the dietary things as well as exercises. Many a times these are chronic lifestyle modifications which are difficult for many other people because it's not one time, or maybe it's a short time. So in such cases, liposuction helps in motivating the person for the adjuvant therapies.
Yes, that was pretty clear. Sir, who are the candidates who are right for this procedure? I mean, in the sense, who are the good candidates for liposuction?
Patient selection is very important to get the best results and to have least complications or no complications. Many a times they do have associated comorbidities like diabetes, sometimes hypertension, sometimes hypertriglyceridemias and hypercholesterolemias, and sometimes they are also associated with hypothyroidism, which is quite common among the obese people. Sometimes younger women, they do come with infertility, so they do have associated PCOD. So the good control of diabetes, hypertension, and the cross consultation with a dietitian and a physician and endocrinologist is very important to make sure these are brought under control so that you can have a safe procedure. So anesthetist in such cases need to be an experienced one, because sometimes they do have difficult airways because of obesity. Sometimes they do have obstructive sleep apnea syndrome. So a very good anesthetist in such procedures can give you a better results.
Yes, sir. Again, you mentioned about complications, sir. What are there's a lot of myths and misconceptions associated with this. And many people also do feel there's need for lots of blood transfusion. So, what are the common complications associated with this procedure, and are blood transfusions really necessary?
Earlier procedures, the earlier method of liposuction, there was some amount of bleeding which mandated blood transfusion in such cases. The advances in technology and the methodology what we use, we call it as a tumescent anesthesia, wherein lot of fluid is injected almost to the double the amount of fat that is being removed. Say for example, 5 liters of fat is being removed. We inject almost up to 10 liters of fluid along with a drug called as adrenaline, which causes vasospasm, means the blood vessels become small so that they don't bleed, along with a local anesthetic drug which is injected to make it painless. So the amount of blood loss tends to be very less, and it is rather an exception than a rule to have blood transfusion in liposuction cases. Massive liposuction, which normally we do up to almost about 15 liters, in such cases, maybe one or two cases may require blood transfusion, but as a general rule, there is no requirement for blood transfusion in such cases.
Okay, sir. Sir, does again these procedures, do they need admission, and what are the post-op management needed?
Minor liposuctions, maybe about 5 liters, can be performed as a daycare. We have performed up to 10 liters liposuction as daycare. It means discharge on the same day without admission. But one has to be absolutely sure that they do not have any comorbidities. One. Number two, they stay nearby or preferably in the same city, and they are not traveling to uh, cities far away from the place where you are operating, and they do have medical backup. If they're in the same city, definitely they can be performed as a daycare. If they are from different places or associated comorbidities, or if they are not under control, then preferably they need to be admitted so that the procedure becomes safe.
Okay. So previously you mentioned in the first setting and second setting. So are these surgeries performed in multiple settings, or can it be done in a single step?
See, I do liposuction up to 10 liters in a safe way in one sitting. In cases where the patient requires more than 10 liters, it's always better to be safe than sorry. So you can do 10 liters at one sitting, let the patient get stabilized. Maybe after a month or two, you can perform second procedure. Like say for example, you have done tummy and buttocks. So you want to do thighs and calf, or maybe arms or chest, or even the back. So they can be done in multiple stages, maybe 2 to 3 stages, rather than trying to do massive and end up in complications.
So I think that was adequate information. We did shed a light on lots of myths. Before we conclude, sir, how do you think this procedure will help in improving one's own self-esteem?
See, every human being or maybe even an animal would like to look beautiful. So nobody would like to look ugly. So we do have an image about what is beautiful for ourselves. So trying to look beautiful is one's right. So if somebody is not happy with body shape, there is a bulginess here and there, obesity. So sometimes there is body shaming. So or sometimes the patient themselves don't feel good when they are looking into the mirror or when they are seen in photographs along with their colleagues. So they are the right candidates to undergo these procedures. So what happens is it puts a lot of self-confidence into these patients. They start performing better in terms of their academics, in terms of their career, in terms of mingling with their friends and colleagues, and there is a huge self-esteem. So it's the self-respect also they do gain. So it's not always like cosmetic surgery is just to look good. It's also to make them feel good.
Sir, I think we covered almost all the topics about liposuction, and we even busted lots of myths regarding this procedure. Thank you so much.
Thank you.